Good morning, everybody. Good morning. You're all very welcome to this session on meeting the robots. I think it's very well titled. So hopefully this morning we'll get a better understanding about robotic process automation. And just to say that this is a very, very important part of our overall reform programme across the public service. We are really pushing innovation. It's pillar 2 of our public service 2020 programme. And we're really very anxious that we will all take on board, where we can, automation processes to replace, I suppose, routine, boring processes really that are taking up a lot of time, very time consuming. So this is a great solution in many places across the public service, and we have made a lot of progress in recent times in pushing forward automation. Now, we're very, very thankful for the response we've got since the COVID crisis. In fact, the take-up of robotic process automation has been quite considerable, and we've been very heartened by the amount of interest that there is in robotic process automation during this time. So this session this morning is to explain to you how easy and how simple it is to draw down from the framework that we have created, and to begin to look at processes in your own organisation and see whether they can be best automated. Now, we're fortunate this morning that we have one of our new ministers, Minister Ashleen Smith, who is Minister for E-Government and Public Procurement. Now, Minister Smith was to open this session this morning, but unfortunately there's a vote in the Dáil this morning, and he's going to join us at a later stage. So we'll start the process by, I'll introduce to you Mark O'Connor from UiPath, and Mark is one of the vendors and one of the suppliers in our framework, and Mark is going to take us through the first presentation in this Meet the Robots event. Over to you, Mark.
Thank you very much, Lucy. I'm just trying to find my slides here. There, 1 second. I'm just sharing the screen now. Can everyone see my screen?
Yeah, should be coming up now, Mark.
Okay. There we go. Thank you very much. Thanks very much for organising the event today. All the team in Deloitte and the team in the OGP, Philip and Sean. But we're here today to talk about robotic process automation, and as it was titled, we're going to go slightly differently. We're going to let you meet the people that are going to help you meet the robots. And I'm going to give you a bit of a background as to UiPath and what services. Who we are. Basically, we were a company founded in Romania, and I'm just going to give people a bit of a background as to what's happened in the last month. For anybody who knows anything about us, they may have seen that we got something there yesterday, and our valuation over the 10 billion mark, which was obviously led to great excitement within the company yesterday. Forbes announced us as one of the top 50 AI disruptors in the world. We'd like to thank the team in Deloitte, who have ranked us #1 in the technology Congress. And we'd like to, on CNN, obviously, who ranked us as one of the top 50 disruptors for technology in the world. What do the markets say about us? What do Gartner say? Gartner say that we're a leader in the Magic Quadrant, top right, which is always the best place where you want to be. The same thing with Forrester Wave. So we believe we're the market leader at this moment in time. But most importantly, we want you to meet the team behind that is here to support the Irish public sector. What's unique about UiPath in this framework is that basically our team is based here in Ireland. I head up the public sector area. We've Francis Donoghue, who is our customer success manager. Francis is from Galway. Siobhan Ryan, who's based in Limerick, and Michael Ellis, who's also based in Dublin. From my background, I have worked with the Irish public sector for the last 20 years. And for the last 8 to 10 years, prior to joining UiPath, I was the head of public sector for Three Ireland, and that was 2002 before we got bought by Three. So there's a good chance that people who are on the call here, I may have met you over the years, or I may have done business with you. What can a robot do? Well, here's all the technical things that a robot can do, but I'm going to keep it very simple here because in reality, the robot will log on to any application. It will move any files and folders, read and write to databases, scrape data from the web, connect via APIs, open emails, open attachments, make calculations. But what I want to do is to give you some practical uses of where this has become in. And only yesterday we made our announcement there that we have partnered with the Hsc to build a centre of excellence with them, with Deloitte. And we're working very closely with the Digital Academy and the Hsc, and we had our launch yesterday. But what was really interesting when we spoke to Kevin Kelly and I asked Kevin, you know, how are you finding automation? How are the team within the teams finding it? You know, and they said they were bowled over by the benefits they are receiving on a day-to-day basis. When you look at the stats there, you know, they're really, really powerful. You know, if you take the finance process, 6.6 minutes for the robot versus 111 minutes for the human. And one thing that's unique about UiPath is we don't sell our robots per process. We say to you, this robot has 168 hours in a week, and it will work 15 times faster on average than the standard human. What do you want it to do? Where can it help you? Where can it bring value to yourself? You know, during COVID, everybody heard about the Hsc and the amount of people they had to hire. And one of the big worries they had while hiring staff at that moment in time during COVID was the Garga vetting process and how long it was taking them. We worked with them and the team worked with Deloitte there, and obviously they used our technology to show how the process could be moved from a 10-minute process down to 30 seconds. So it's saving them 500 hours per month, and they've been 100% accurate. And obviously, what's close to everyone's heart here in Ireland is the work that the likes of the Health Surveillance Protection Centre have been doing. And what we've been helping them is using the technology there on the COVID reporting. And if you look at it there, the robot is doing the reporting in 3.3 minutes versus 26 minutes per human. So that on every 100 cases, they are saving 38 hours. And obviously, in the current climate and over the last couple of months, those savings, you know, are really, really phenomenal and really, really benefit the area. This is a project that is really close to my own heart, and it's the project we did, which was a pro bono project we did with the Mather Hospital. The Mather Hospital approached our team here in Ireland and asked for our help. And they said the infection control nurses were completely swamped. They had figured out they were spending 4 hours a day just on reporting before they could actually see basically a COVID patient. They needed to move information from the lab system to the patient access system. Then they had to contact people, whether they were positive or negative, assign it to a nurse specialist. And what happened there was we worked with the team because what I say here is meet the robot, but in reality, you're meeting the humans because it's the human knowledge which is transferred into the robot. And that was the key to it. Jincy Jerry, who's the Assistant Director of Nursing and the nursing team in the Mather Hospital, it was their knowledge that we worked with them to transfer that in. And the point they were making to us, there's highly trained, skilled employees that were doing 4 hours of repetitive tasks before they could even see a patient. We've now freed up that time. Every morning they walk in and all the COVID work is done. Now the robot is also doing all the work for infection control. It's now creating a patient access number as the patient is on. And they had great fun recently when they named the robot, and the name they gave the robot was Fionn. In the case of the Hsc and Health Business Services, they've named their robot Bertie. So two very, very Irish names that were put in place. But the great thing we had with the nurses there in the Mather Hospital was they said that the robot had to have a man's name. And I asked why, and they said, well, although it works 15 times faster, it can only do one task at a time. So that's when it says only women can multitask, not even a robot. Another project that we were working very closely on during COVID was we worked with the Department of Employment Affairs and Social Protection. And what we did was, as you can imagine, we got a call on a Wednesday, and this needs to be built by the following Thursday. And we deployed an end-to-end solution using UiPath's RPA technology. We're one part of the loop to do this, but it enabled 600,000 individuals to get paid by the end of April. Without RPA technology, this wouldn't have been possible to be able to process that sheer volume of applications that came through, and obviously took the whole stress out of it for the employees in the Department of Social Protection, but also from the Irish public. And that was enabled by having a team locally here on the ground that could work with them. We also, cross-border, we've worked with the team there in Deloitte to do firearm renewals for the Psni. And obviously, it's like all things in Ireland, everybody leaves it to the last minute. And so they would renew about 18,000 firearms a year, and basically there were 95% of them are renewed over a 3-week period. That meant they had to bring in staff from other areas to actually manage the demand. But now they can they've automated the process right the way through. And that has enabled them not to have to move staff from other areas to manage the short time frame that they needed, and they've been able to process all of these on time. One of the ones that everybody knows about here in the Republic now is the online renewal service for your passport. That was launched in September 2018. I'm not sure of the latest figures, but I think it must be close on 300,000 passports that have been processed through at this stage. And that's using UiPath technology in the background. But what I'm saying here is it is our technology, but it was the knowledge of the staff within the Passport Office who identified how RPA could benefit them and how this service could actually take the pressure off them. And this was rolled out during Brexit. As we all know, everybody in the UK that had any way of trying to get an Irish passport applied, and they were just absolutely swamped. But what you have now is an average renewal time of a passport prior to RPA was 15 days. You're now at 48 hours to get your passport renewed. So what you have is happier staff in the Passport Office, but also happier Irish public, because as I said, just like the firearm renewals, in a normal world, when people do go on their holidays, they usually only check their passport a couple of days before they go. Now they're able to manage this high volume of people over a very short period of time. A lot of times we get asked, how secure is it? And I've been able to I put references to a number of government agencies here in Ireland, from the likes of NASA, the likes of the CIA, because obviously from our perspective it's all about making sure the data is secure, building the governance around it, securing the access, and making sure from a standards compliance point of view we meet all of them for you. Another unique thing to UiPath, and one of the real differentiators, was when we partnered with the Hsc, and obviously in the case of social protection, and we've also with the likes of the Road Safety Authority, who've put a number of people through our UiPath Academy, was that we're able to train people for free, and they can train in their own time. This was launched in 2017. We've had 510,000 people use the Academy. We were only on to Galway County Council there the other day who are using it. Really what we want to show you how, as people within an organization, how you can go on the RPA journey, and all the different roles that are involved in this RPA journey, right from the person who just has the idea, to the person who evaluates the idea, to the person who potentially builds the robot, and then making sure at all times that there's certification and upskilling, because what we want to show is our investment into Ireland here, but also to our investment in the Irish public sector, by upskilling the people that are already working there and adapting them to work in the new digital workforce. This is our training catalogue, and this is what we've agreed with the Hsc, and this is what we're going to be doing, is that we've already had the first 40 people go through the starter kit. They're also doing our automation hub training, which is a tool that the Hsc have bought, which enables them to evaluate their own processes. And this is going to be used across all hospitals in the country. Only yesterday I was training 40 people in the Mater Hospital on how to use the tools. But it's a journey for you. Get your understanding of RPA, but then get your RPA training, your solution architect, your infrastructure engineer, your implementation manager, your business analyst. These are all the different skills we think that organizations in the public sector are going to need. And all of this training is available for you. The UiPath Academy is online. Log on at any time, do the accreditations, to upskill yourself. Another unique thing is our academic alliance, where we're partnering with universities here in Ireland, where we're providing our training for free and providing all of our software for free to the universities. Only yesterday, we kicked off discussions with the County Institute of Technology, TU Dublin, are going to go live now in September. Here's one we did yesterday, which is the Hsc Digital Academy, which is training that we ran yesterday, which is extremely successful. Great feedback from the team, and now we're going to be progressing that on, and that's all fitting into the Centre of Excellence we're doing. There's Siobhan with NUI in Galway. They're now training all their accountancy students in robotic process automation and using UiPath software, because we provided it all for free to the university. You know, now they're going into their business students, their computer science students, because what we're really trying to do is to upskill not only people in the Irish public sector, but the students that are coming through. One of the names that's missing off my list is a guy called Anthony Ryan, who was working with me, and we trained him up, and now he's basically gone from UiPath, and he's taken people in from NUI Galway, he's taken people in from Trinity College who are doing automation studies as well, to work in the Walmart Centre of Excellence, which is now based here in Dublin. And that was built upon the idea of the relationship that UiPath have with the colleges here in Ireland. The Chartered Institute of Accountants, there's Michael from UiPath on the right-hand side with Pascal Donoghue, are now using UiPath software to train all of the accountants that are coming through, all the accountants in Ireland now at this moment in time. So what I'm saying here, guys, is that you have the knowledge, you have the skills, we have the technology, and we're here to support you in whatever way we can. We're happy to meet any of you at any stage. As I said yesterday, I was in with the Mather Hospital, Galway County Council on Friday. We've just gone live in a number of projects with the Road Safety Authority, you know, and we've got multiple discussions going on with other government organisations at this moment in time. But key thing to ourselves here is we're here to invest in you. And that is our aim, and we're going to make those resources available to anybody in the public sector. Happy to meet with you at any stage. Just my details will be passed on. And what we want to is, and in many cases, I probably have already met you, or I've already had discussions with you, or I've already done business with you in the past. So on behalf of UiPath, I look forward to meeting you over the next while. Once again, thanks to the guys for organising the event today, and open for any questions.
Okay, Mark, so we have a few questions there. I suppose, first of all, from Lawrence, practically, how can staff members access the free training that you mentioned?
It's very simple. You Google, and Lawrence, if you want to email me, my details are there, because we have a customer success manager who'll help you go through that training, and Francis Donoghue. But if you email me, or if you go online, it's the UiPath Academy. Just Google that. Just register and you can get going straight away.
Okay. Another question from Colin Russell Conway. Is the robot based on-premise or on cloud? And is the data that's processed kept? And if so, for how long?
Okay, it can either be on our cloud, public cloud, private cloud, on-premise. Just to give the example of the work we did with the hospitals here in Ireland, or we did with social protection, they have built them as an on-premise solution, and they're the only people who have access to the data. We don't have access to the data. We're happy to do data processing agreements with any of the organizations to show that we don't have access to the data. But obviously, we're starting to see a lot of people talk about hybrid environments where they might have the robot, the orchestrator, which tells the robot what to do in the cloud, or they might have the robot on-premise. Because I heard a great analogy yesterday from Kevin Kelly, who leads the Centre of Excellence in the Hsc, is that we're providing you with a robot, you're putting the uniform on the robot, and you're controlling who has access to that robot. So you tell us where you want it, and we'll provide that for you.
I hope you don't have to pay for the uniforms.
No, I hope that yourself.
Okay. I suppose another question here comes from Claire Moran. Is the use of robotic process automation only suitable for processing inquiries or applications where there are regulated structures in place, and how do they cope with changes?
No, like what we do say is the low-hanging fruit is stuff there that there is a structured end-to-end process and there's rules and it's very rules-based. But as we get more into the AI side of things and the machine learning, you can actually program the robot to start making decisions. And that's where we see this going. But we always say to people, start with the simple stuff, build the confidence in the organization. But we're very happy to show you how we can actually program the robot. And that's what we were doing in the Manor Hospital yesterday. In the lab team, we're doing the next phase of a project where we're doing clinical coding there. And once a code is applied, the robot start to make decisions where this patient information is passed on to, what department it goes to, or if it's missing information, sending it back. So, yeah, what we will say is start easy. Everything you want to do is possible. Think of it this way. If you can do it and it's using computer applications, we can train the robot to do that for you as well.
Okay. And I suppose one last one then, I suppose, comes from Irene Martin, and Irene runs the Centre of Excellence out in Revenue. She says she wants to know what's the unique selling point of UiPath?
I suppose the unique selling point of UiPath, and I think there's a couple of them, is that I think first and foremost, if you take what we did with the HSC, was the scalability of our products, how we could scale and move with them, how we could actually. It was also our knowledge at a local level here in Ireland that we could actually invest, because another great line I heard yesterday was everyone in the HSC is talking about RPA as an overnight, basically an overnight success. As we said, an overnight success that took 2 years. So it was our investment in the team within the HSC and our training structures, and the fact that we make all of our training for free, and the fact that we have bodies on the ground in the likes of customer success and the likes of pre-sales. So we reassured them that although I'm also saying the likes of Forrester and the likes of Gartner are saying our technology is the best, but I think our unique selling point is the fact that we're here to help you. We're here to give the resources. We're here to do the training. And the next generation of people coming from the universities will be trained in UiPath. So you've got your next generation of workers coming right the way through.
Okay, listen, thanks very much for your contribution there, Mark. We are still expecting our minister at some stage, but he's not here yet. So we're going to hand you over now to, I think it's to, sorry, you'll have to correct me if I'm wrong there, Louise.
We're going to put to Blueprism next, and Philip Sheen is going to lead us in his discussion.
Thanks.
Thanks, Philip. If someone can just confirm that you can see what you can see.
Yep.
Brilliant, smashing. First off, thank you very much to the Government of Ireland. Thank you for Deloitte for the invitation to speak today. It's lovely to be here. Mark, thanks for, I think, a really good overview of what kind of RPA is capable of doing. I'm going to talk through very briefly this morning through a Blueprism Cloud, or BPC, why ultimately, as a public service and as the Government of Ireland, you fundamentally should be focusing on outcomes and not really the technology, which I know is probably a little bit counterintuitive coming from a technology business. Why you should be looking at consuming a software as a service offering rather than in a manner which has legacy been deployments around on-prem and cloud-based services. A little bit about our pedigree and track record in government and public sector, and also touch on the benefits that we've been discussing about Deloitte, and also what that means actually in real terms about how that can deliver benefits to the Government of Ireland. So just a little bit, very briefly. So my name is Philip Sheen. I'm fortunate enough to run the sales and commercial function for Blueprism Cloud across UK, Ireland, Benelux, mainland Europe, Middle East and Africa, which is a hell of a mouthful. But I'm joined on the call by Patrick Shepherd, who runs another part of our public sector business, which is healthcare and life sciences. So what I'd probably start with an outset is actually what is it that the Government of Ireland is looking to gain out of its strategic relationship with Deloitte? I would hasten to add that it's probably not about technology. It's probably about delivering better outcomes, richer target operating models, and actually ultimately frontline services so that Deloitte can empower the Government of Ireland to deliver the best possible citizen services it can. We only have a short time here, 15 minutes to cover. This is going to be a little bit like a sort of a stone skimming over the top of a lake, but this is, as Mark alluded to, this is possibly the most disruptive and transformational capability that I think most of us on this call would have seen within a generation. So the aim here is to kind of whet the appetite a little bit, generate a level of interest, and then from here, we'd love to engage in slightly more meaningful dialogue. So if we kind of go over what we're looking to achieve as a mission, Blueprism and Blueprism Cloud, we're looking to enable you as government to collaborate amongst yourselves, share learnings, share the practicality of collaboration, leverage scale, support training and enablement, but ultimately deliver the best possible outcomes. And there are three key things here that we want to enable you to do. So that is to be the most efficient and productive version of your organisation that you possibly can be. I'll touch on that in a second. Patrick will touch a little bit on staff morale and employee engagement and what that actually means in the real world. But we have this utopia position where we want to try and help you remove service islands from within your organisation. We go back to 2008, there was a central government review, the Varney review, which talked about these service islands of having different pictures of the citizen, different pictures of your customer in different parts of the organisation. We want you to help you remove those service islands, have a single view of the citizen, shorten delivery times, exactly as we touched on with the passport example. How can you deliver an outcome to that citizen, that housing resident, that victim of crime, that patient? How can you deliver that service in the shortest possible time? And how can you also, at the same time, how can Deloitte help you actually reduce your overhead and your cost of delivery internally? Very quickly, and just this slide and the next one, I'll touch on the technology for a second, but what are digital workers? So digital workers are effectively a digital version of you and I as humans. So we are multifaceted. We can answer phone calls, we can read letters, we can send SMS texts, we can interface on web chat, and that's exactly what we're looking to provide through the digital workers at Blueprism Cloud. So I'm going to make a very bold claim, but RPA is dead. RPA is what we view as a legacy technology now. It was invented back in about 2008 by our founders, Jason Kingdom and Alistair Bathgate at Blueprism Group back in 2008. But what we've done at Blueprism is we've taken that core capability of RPA because it is fantastic. It allows for what we call frictionless deployment, and as Mark alluded to, it allows RPA to interface at the front end with any application. So it doesn't matter where that application is, it can interface and mimic the behavior of a human being. It requires no coding, doesn't matter about APIs, it can just interface at the front end. But on its own, it's a very singular and what I would term as legacy technology. It's nearly 10 years old now. So what we've done at Blueprism Cloud is we've taken the concept of RPA, and then over and around that, we've added a set of very, very rich functionality which touches on things like SMS gateway, web chat, natural language classification, natural language processing, the ability to disseminate and understand unstructured data. But we've also added aspects like AI and machine learning to the platform. And what we've done is we've collected that all together, and then we've actually delivered it in a software as a service. So I suppose the example I would give is, I would ask anyone on the call, when was the last time anyone either rented or purchased a DVD or a video, or when was the last time somebody went to a record shop and bought a CD? We don't anymore. We subscribe to Netflix, we subscribe to Spotify, Apple Music. That is how we consume services today in the year 2020. So what we've done is we've taken all of this very, very rich technical capability, pulled it together, and it allows Deloitte, the Government of Ireland, to deliver outcomes. And what this allows you to do is take something that's ready to drive, not ready to build. You can consume a plethora of very, very rich, deep capabilities from the single platform for a fixed fee, year in, year out. So this allows you to actually focus on frontline services, target operating models and delivering outcomes, and in the background, Deloitte can support you. There's absolutely no talk here about the technology. It's about what it's going to allow you to deliver as frontline services. Patrick, if I can just hand over to you now, and you can talk a little bit about customer services and what it means for actual people on the ground.
Thanks, Phil. So as you can see on the screen, guys, I think it's fair to say we've got a demonstrable record of working with the public sector. This is just a snapshot of the organisations that we work with in the UK. I head up the NHS, so I'm remarkably passionate about the work that we do. I think, why have 37 NHS trusts chosen us as their long-term partner? Why did can you hear me okay? Is there feedback?
There we go, yes.
Great. Why did NHS Business Services Authority choose us to automate the pension process for 2.1 million NHS staff? And why did the Care Quality Commission trust us to automate the COVID notifications of death in care home process, which goes directly to Matt Hancock and Boris Johnson? Well, the answer is obviously multifaceted, but I believe they wanted to build for the future. They wanted a platform, not an IT widget. They wanted to know that if finance wanted to automate the accounts payable process in a council, or if HR wanted to use a chatbot capability in a hospital, or use the SMS gateway for one of the police forces, that they could do that without spending a penny more. Ultimately, as Phil said, in our home lives, all of us on the call, we don't consume goods and technology like we used to. As Phil said, we don't have VHS and DVDs lying around. We all want a software as a service that has a fixed cost, that upgrades regularly, and that we can just consume. I like to think that we are the Netflix for automation, and our customers want to spend time saving staff time, not spending time just trying to make things work. Now, I could talk about the 2.1 million pound year one operational cost saving that the Royal Free Hospital made through their back office transformational work, or the reduction in time to hire by 5 days at the Royal Marsden Cancer Hospital, or even the 11,500 hours that Colchester Hospital saved just last month processing referrals. But this amazing work but it's not really about that. It's about the people. Both my in-laws are A&E nurses in Lincolnshire on the east coast of England, and I've seen what they do every single day just to keep people alive, and it's incredible. And we do this for people like Christine, that you can see on the screen now, who's one of the amazing medical secretaries at Ipswich Hospital. I think it's fair to say, when we engaged with those guys 2 years ago, she thought that this was turkeys voting for Christmas. She thought that this was Terminator 2 and that it was going to take her job. And actually, once we'd built this process out within 12 days, which was basically 16 people processing 2,500 referrals, she recognised it wasn't that. Ultimately, she said to me it was the first time in 6 months that she'd managed to have a cup of tea and a biscuit and get home on time to see her kids. And that's what we do. We give time back to people. That said, I think the biggest reason that we're a market leader in the NHS in England is because we support and allow organisations to share. It's absolutely in our DNA. We have the NHS Marketplace. It's now called the Nhs Digital Exchange, which is built for the NHS by the NHS with at least 40 automations in there right now that allows them to create, collaborate and share. So things like ERS, Lorenzo, PAS, Cerner, Epic, all of those object items and automations that people want to share and collaborate on are there and available for our customers now. A great example is Ipswich Hospital built an antibody test during the height of COVID. They shared it with 4 other hospitals. Seamlessly, they just dragged and dropped it onto their platform and it was ready to go. We have Dorset and their ICS, so an integrated care systems. That is an entire geographic region in the southwest of England working together. So the council, police forces, GPs and hospitals sharing and collaborating on a single platform. Why would they have servers in one room, a bit of servers on the cloud over there? It doesn't make sense to do that. They want to share and collaborate their resources. We allow organisations to break boundaries, break geographic restrictions. It doesn't matter whether you're sat in a bar in Dublin automating processes for the HSE or on a beach in Sydney. You should be able to easily, on your smartphone, laptop or desktop, build and scale across an entire country. And that is the vision. That's the vision that you guys are looking for. You're looking to build for the future. And we can make it a reality because we already do this today. Thanks, Phil.
Thanks, Patrick. And I think so. Just as we kind of wrap up, there are, I suppose, probably a couple of core messages that I'd like to impart. There's a lot of hype and hyperbole around automation and the automation space at the moment, and it's probably very easy to be caught up in that. It's largely being termed as the fourth industrial revolution. If we kind of look back through the previous ones, 1760, the invention of the steam engine, early 20th century, petrol engine, air flight, mass production, 1950-ish to about 2000, semiconductor, mainframe computing, personal computing, internet. 2008 plus, biotech, nanotech, automation, vehicular and computing. We are now in this age where people are looking to consume services and deliver outcomes in the most efficient and productive way possible. Consuming automation in a software as a service, secure, benefited way is absolutely planning in the year 2020, looking forward to the outset that you have for the next 3 to 5 years with Deloitte. It should fundamentally be predicated on building for the future. The only way that we consume services now is in that agile and dynamic way. And that links very, very strongly to how you deliver services. The challenges that you face at the moment within your organizations are because people are siloed in parts of the business because they have skill sets which are amazing, but they're singular. What we need to do is empower you to have a dynamic and intelligent virtual workforce that is, exactly as we've all agreed, multifaceted, can understand and interpret structured, semi-structured and unstructured data any time of the day or night in any part of an organisation, as Patrick alludes to, without boundaries. Doesn't matter whether it's central government, local government, health, police, fire, ambulance, or housing associations, the ability for that workforce to go anywhere and do anything. So the point here is about disaggregating the work from the worker and delivering outcomes, removing the focus on processes and allowing you to orchestrate work dynamically. And as we touch on that, what we look is about how we're going to actually enable Deloitte, and in partnership with the Government of Ireland, deliver the best possible outcome. So what you don't want in Deloitte is you don't want Deloitte staring at their toes, trying to figure out how to plug the technology together. You want Deloitte to focus on delivering real strategic change. And what we can do through Blueprism Cloud is exactly that. We go back to 2008, we were originally a company called Autonomy. If we go then to 2017, the public sector function started at Autonomy. 2019, Blueprism Group acquired Autonomy. This year, Autonomy has been rebranded and is now fundamentally part of Blueprism as Blueprism Cloud. We're a stock market listed organisation. We have profitable revenues of 110 million. And what that means is that we're fully accountable. We're accountable to the city, we're accountable to our shareholders, and we're accountable to the analysts within organisations. And what that gives you is a very, very safe pair of hands with an organisation that is leading how to deliver software as a service automation that is simpler to deploy, it's more scalable, allows you to deliver faster ROIs, and as Patrick's alluded to, is collaborative in a way that you probably never thought possible. And what we're going to do, hopefully, is work with you and Deloitte to actually make that possible. So just to wrap up, in classic newsreader style, we wanted to cover off who Blueprism Cloud are. Hopefully we've done that. Let's have you absolutely focus on outcomes. Do not think about the technology. Consume it as a service and actually focus on delivering your frontline services to the best of your ability. Patrick touched on our pedigree and track record across government and public sector. It's extensive. It's the reason why the Medicines and Healthcare Regulatory Authority have trusted us to automate the authority for NHS organisations to deliver medicines. It's the reason why we deliver 1.4 million NHS pension processes and why we deliver 1.2 billion prescriptions automated through the NHS BSA. Thank you very much for your time. Conscious we've covered off a lot. As I say, it's a really interesting topic. If anyone would like to pick up with us around some of the things that Mark mentioned around security, training, governed learning, things like that, absolutely willing to delve into that. Please, thank you very much for your time.
Thank you.
Thank you very much, Philip, and thank you, Patrick, as well. Now, I'd like now to introduce our Minister, Ashleen Smith. The Minister joined the department very recently, and you're very welcome, Minister. You're very welcome to this event, and we know you're extremely busy, so thank you for launching this event this morning. The Minister is Minister for E-Government and Procurement. So today's event is very relevant to your brief, Minister. So I'll hand over to you now to say a few words. Thank you.
Good morning, everybody. You can hear me?
Yes.
Yeah, great. Okay. So my name is Ashleen Smith. My background is that I have a degree in computer science. I spent the last 30 years working in IT, and most recently working in a hospital. So I was particularly interested in that presentation about the NHS. I was doing data analysis, but also I was looking at processes. So I'm delighted to take part in a presentation called Meet the Robots. Obviously, that really sets the expectation high, and I was thinking, great, Minister for E-Government, now I get to meet the robots on the first day. But of course, this is about process automation. This is about getting things to happen automatically in your organization. And presumably, it's only a matter of time before you find a way to automate ministers like me. So what are we going to do today? By the end of today's session, we're going to gain a comprehensive understanding of RPA, different offerings that are available within our public service, and you're going to hear about how those benefits can help your organization, whether they're relevant to you, whether they're achievable for you. And in particular, you're going to hear about how the technology is being used in public service settings to make the services that we provide quicker and cheaper. Crucially, making the lives of our public servants easier by relieving people of mundane, repetitive, and labor-intensive work. So it's not just about efficiency, it's also about being able to deliver a higher quality of service, and also just being able to deliver something that you couldn't do before. It's actually enabling new things. I think you've got three things there. You've got quality, you've got efficiency, and you have a wider service offering. So I'm particularly pleased to be appointed to e-government because I actually know something about it, but also the other element of my brief is public procurement, buying things, of which I'm told the OGP, the Office of Government Procurement, spends about 15 billion euros a year on goods and services. So it was well worth finding efficiencies in there. Also, I want to say that the OGP has helped to put in place an easy-to-use procurement mechanism to enable public service bodies to quickly access RPA and services. So, to get benefit from RPA requires more than just learning technology or a technology mindset. To get the real benefits, you need to think about re-engineering your business processes, looking to finding there's a better way of doing them, a tighter way of doing them, whether some parts are obsolete or whether you can completely rearrange the way that you do things. So in other words, it requires having an innovative mindset. It is a cliche that overlaying technology on an inefficient process doesn't have extra cost lower. You use technology to enable yourself to do things in a different way, and that takes a particular enthusiasm and innovation. But also it means that you do as much work as possible before you get down to the technology, before you start turning it on and typing buttons and so on. You're looking at whiteboards and you're thinking about everything you can do. The longer you delay starting the technology, the more you think about what it is that you actually do, the better. And you can get help from the Reform Office in this. So this is the training and consultancy advice you can get from the Reform Office, and I've met Philip McGrath, and I'm really impressed. So the team with the Reform Office of my department are more than happy to engage with any public service body considering RPA to offer advice on potential processes or areas that might be conducive to this technology. And they're also happy to advise on how to go about identifying the right people to begin implementing this solution in your organization. Equally, the team in the OGP is happy to give advice on how to use the procurement framework. So I think this is a really important part of what you're doing, rather than just looking at this as a piece of software or a piece of technology. So I'd like to really welcome our speakers. I heard the presentation there from Philip Sheen and Patrick Shepherd from Blueprism. Earlier I was voting in the Dáil, so I apologise for not being there at the very start of the presentation. You have three different vendors who are presenting today, and I guess each one probably has strengths in particular areas, and it's going to be up to you to decide which one is best for your organization. I particularly want to thank Lucy, whose office I was occupying when I got to the department first, and I want to thank Philip and John from my own department for organising today's event, and Tim and Louise and Deloitte for making themselves available to talk about how they can help you to start implementing this solution. I hope you enjoyed today's webinar, and I trust that it will give you some food for thought on how to drive innovation and new ways of working within your organization. So I'm now going to hand you over to our next speaker. So thank you very much, everybody.
Minister, we really do appreciate you giving that great, I suppose, support in your new role.
Thank you.
We know, Minister, that you have to go because you have an extraordinarily busy schedule, but no doubt we'll be back to you, and at some stage we'll, I suppose, take you through the many, many examples we have of where we have successful automation. And in particular, Minister, we have we've been blown away by the amount of take-up of these processes during the COVID crisis in the last number of months. So it can only grow and grow. So thank you very much, Minister, and we'll be back to you on this. And now I'll hand over.
One last thing I want to say is that I think that, obviously during the pandemic, there's been a great take-up of technology, and people have innovated in ways. They've done things both using technology for social purposes, video calling their family, or using government services online, or using commercial services online that they didn't do before. There's been a lot of adoption of technologies that hadn't happened before. And also we've had this COVID tracker app come out from the Department of Health, which has given a newfound confidence in government IT and a feeling that the government really can present something that's as good as a commercial offering. And I'm really positive and optimistic that we can really digitize our public services and give people better services as a result. And I'm delighted that you're all working on this. Thank you very much.
Thank you again, Minister.
Thank you.
So I'll hand over now to Philip, and Philip will take some questions from the previous presentation, and he'll also introduce the next presentation. Thank you again.
Okay, thanks very much, Lucy.
Thanks so much.
Okay, so I think we have a bit of feedback there. So if everyone goes,
I think the minister's microphone's still on.
Okay. Okay, so Philip and Patrick, sorry, I think we're still getting some feedback there. So if everyone on the panel can mute themselves, thank you. Okay, so Philip and Patrick, a question came in here from Jason Evans, and he wants to know, do you have some sort of online training similar to the academy that UiPath spoke about?
Easy question, easy answer. Yes, there is both the Blueprism Academy and the Blueprism University available online. We can send links through. It's probably easy. You can Google it, but we'll be very happy to share links with anyone afterwards. Yes. Okay.
We've also a question in from Katie Clare. Katie was one of our early adopters in the Revenue Commissioner, actually using Blueprism, and she wants to know what do you advise in terms of good governance in large organisations.
It's interesting. I think there are two things that either make or break automation deployments. One of which, and I think is most critical, is probably cultural adoption, and second which is internal governance. So first of all, I think it's critical that organisations are taken on the journey, and individuals within each organisation are fully made aware of what the capability is. And Patrick alluded to it. It's not this rise of the robots. It's here to try and support people. But the biggest thing is around governance. So I'm trying to understand that, and the minister touched on it a second ago, is actually map out what you're trying to automate before you just run into it. There are countless examples, and again, different organisations have different names for them. Robotic operating models, centre of excellence, automation teams. It's absolutely critical, though, that the business understands this and goes forward with a business mindset, and then the technology team and the technologists support that. So I think governance is critical, yes.
Okay, and I'll finish off. Your USP, what would you say it is?
I think we made it quite clear, really. I mean, apart from being a lovely set of people, but actually, on a serious note, the key USP is the model that we have. It's a software as a service deployed from Microsoft Azure in a government-accredited, secure manner. But it allows organisations to consume automation in the year 2020 and beyond. We're not talking about bits of software on desktops or trying to configure and buy tin and kit in, data centres or cupboards under closets. We're talking about consuming a service and delivering outcomes in the year 2020, 2025, 2030 from an evergreen platform. Functionality, fixed cost, one place.
Fantastic. Thank you, Philip and Patrick.
Thank you
I think
all.
we're going to hand over to Kat in NICE now. So, John, if you could do the handover there, please.
It's actually to Simon first, thank you.
Okay, sorry, Simon. Simon Bland from NICE.
Hi there. Just bear with me 1 second. Can you all hear me okay?
We can.
Yes, Simon.
Excellent. Good. Okay. Well, thank you very much. Good morning, everyone. Just wanted to thank Deloitte and the Government of Ireland for allowing us the opportunity to speak to you today. My name's Simon Bland. I work as a consultant in the NICE Robotics and AI team covering the UK and Ireland. And with me today, I've got my colleague, Catherine Simons-Porter, who's the Health and Public Sector Lead at NICE. So what we wanted to do really was give you a brief overview of NICE as a business and then focus on our capabilities around robotics and AI and particular focus on the public sector. So just to begin with, NICE is a large global business. We're founded in 1986. We're listed on the NASDAQ. And in 2019, the revenues across our portfolio were $1.6 billion. We employ about just under 7,000 people globally in 35 local offices across 150 countries. We've been in the robotics and AI space for over 18 years, and we feel we've got the broadest capabilities available in a single platform, which covers unattended robotic process automation, which is a lot of what we talked about today, attended automation, desktop analytics, and desktop process mining and task mining. We're the market leader in staff real-time augmentation with NEVA, the NICE Employee Virtual Attendant, and I'll give you a bit more information on that shortly. We've got a wide public sector footprint globally. We're working over 3,000 public sector clients and customers. And in the UK, we have a very large public sector footprint with tens of thousands of robots across government departments. So people like HMRC, Department for Work and Pensions, DEFRA, a number of NHS trusts and organisations, and a number of police forces as well. We also have a dedicated public sector safety business, which provides digital evidence management in the cloud. So working with lots of police forces, emergency services, things like emergency service incidents and call recording and quality assurance and improvement. And I think really just to focus on one of the biggest advantages of working with NICE is the ability to leverage our extensive solution and product portfolio that extends beyond robotics and AI into all areas of customer workforce and digital transformation. Some of the solutions that we offer include things like contact center in the cloud, customer engagement analytics, interaction, sort of omni-channel interaction recording, authentication and fraud prevention. Typically, when you think of process automation, a lot of people will think of unattended automation. So that is repetitive processes automated end-to-end in the back office and carried out by a digital robotic workforce. You know, whilst NICE run many unattended automation schemes for our customers, we believe there's actually a much bigger potential for efficiency savings by focusing on the contact center in the front office and using NEVA on staff desktops to augment the human workforce in real time. So NEVA is the NICE Employee Virtual Attendant. It's essentially a digital assistant that sits on the employee's desktop and works in unison with members of staff and the unattended robotic workforce. You can see we've given NEVA a persona, and as you can see, she's female, so that means she can multitask. NEVA can assist staff with sort of guidance, decision support, compliance and automation tasks, and even sales and upsell opportunities, all in real time, all while they're speaking to the customer. So enables the employee, the advisor, to focus on the call and actually providing the best level of customer service possible. If you look at unattended automation alone, we found that it's around about 10 to 20% of potential processes in businesses can be transformed end to end without any human involvement. By using robots augmenting people via desktop assistance, you can actually access that other 80, 90% of business processes. So NICE believe in attended and unattended automation working together. And to back this up, we've launched a new scheme called NEVA Unlimited. It's a new offer to the market whereby we provide free unattended bots for any customer that purchases a certain number of NEVA licenses. So just to give you a bit of an overview about what NEVA does, because it is slightly different from some of the stuff that you've heard today. So as I mentioned, NEVA sits on the employee's desktop in the background, and it can be triggered by any desktop interaction in real time. And I think real time is the really important thing here. For example, when an employee takes a call from a citizen or a customer in the call center, they may need to access several different applications and systems, and it could be quite complicated. NEVA understands those desktop interactions in real time. So when an employee clicks onto a certain application or inputs a customer's account number, for example, Neither can provide a single consolidated view of the customer in real time through a call out on the employee's desktop. This is without the employee having to access and log into lots of different systems and applications, and it significantly reduces average handle time and eliminates errors. Really importantly, Neither also provides real-time employee guidance to guide employees through complicated processes through call-out screens, and it gives the next best step actions. This has been particularly useful in the sort of current COVID crisis, when obviously classroom training is not really an option, as Neither can support and guide employees through new business processes, or it can assist employees that are new to the business with their training. To give you an example, one of our customers reduced the time to competency for new agents from 16 weeks down to 10 weeks using Neither, so a significant time and efficiency saving. Neither also ensures compliance in real time, so she can help ensure compliance with regulations, prompt staff to read scripts during customer interactions to cover legal points, and ensure process steps are highlighted and executed automatically. Again, very useful in the current climate with rapidly changing legislation around health issues, vulnerable customers, for example. What Neither can also do is hand off to the unattended workforce. It can work hand in hand with those unattended bots, and anything that can be done that doesn't need to be done in real time on the desktop can be handed out to an unattended robot to be maybe processed overnight. Could be something like raising an invoice, doesn't have to be done there and then. It could be added to an overnight batch process. Where human intervention is needed, the unattended bot can pass this back to Neither to alert the employee, who can then provide a response and then pass that back to the unattended robot. And it really creates that seamless process, which is what we're trying to do. Neither can also carry out a huge number of tasks on the employee's desktop in real time, far more quickly than a human can, and with 100% accuracy. So to give you an example, the Environment Agency used Neither for professionals dealing with environmental permits. Neither reduced the admin effort by automatically opening and logging into systems and applications, locating documents, reconciling details, updating applications, creating documents, follow-up emails, and this led to a reduction in handling time from 65 minutes down to 7 minutes for processing water resource permits, and obviously far fewer complaints from the public. So finally, Automation Finder to identify new robotic opportunities. Using desktop analytics and machine learning, we can provide Automation Finder to identify the best new opportunities for robotic automation. And I think really here, one of the most common reasons that automation projects can fail, or they maybe aren't as successful as they could be, is that organisations choose the wrong processes to focus on. So as part of a single integrated NICE platform, we offer Automation Finder, which basically sits on the employee's desktop and monitors and records every action taken, every keystroke, every mouse click, every application opened, every bit of data that's put into the system. And it's normally done with a group of employees in the call centre who carry out similar repetitive tasks. Usually runs for about 2 to 3 weeks. And actually over that 2 to 3 weeks, will generate hundreds of thousands, if not millions of sort of desktop interactions. Then the really clever bit is using advanced machine learning algorithms. The repetitive processes can be identified and given a score relating to how suitable they are for automation. So you can actually see which are the best processes. Once you've decided that you want to actually automate those processes, we have a one-click to automate solution, which essentially populates Automation Studio, which is our design and creation tool for automations, taking away all of that time and effort that's required to build those automations up. I'm going to hand over to Catherine now, who's going to take you through some real-world examples and use cases where Neither has been implemented. So over to you, Catherine.
Thank you, Simon. If you could just pass me the ball.
I will do that. Just bear with me 2 seconds.
So as Simon says, yes, I lead the health sector here at NICE. It's actually a new sector that we have that we've structured just this year. Have you given that automate yet?
Yeah, it's coming over.
Sorry, bear with me. But just this year that we've actually started. Sorry, but bear with me 2 seconds. Because of the demand in the marketplace. My slides are to work. Can you see that? Can you see that, Simon?
Yep, you're all good now.
Right, okay. Sorry about that, everybody. Yeah, we've started the healthcare sector just this year purely because of the demand in the marketplace. So I sit across all of the different capabilities that are within the NICE portfolio. So it's not just relevant to RPA or to indeed to automation, because of all of our capabilities will blend to work with each other in order to provide the best outcome to the patient, the citizen, or indeed the customer. My background is about 25 years within contact centre, but 14 of those years were spent within healthcare and indeed running my own business that won recognition by the Department of Health because we improved services to improve patient access. So I completely understand the notion around improving patient pathways and patient outcomes. In the last 5 years, I've also retrained as customer experience practitioner. So I have a certification called the CCXP, awarded by the CXPA, which is a global organization centered around customer experience excellence. And what this enables me to do is to work with any organization and help them map out their transformation plans, whether it's improving citizen journey, patient journey, or customer experience itself. Of course, from an automation perspective, 2 years ago, there was still a lot of anxiety and intrepidation within the workforce because they thought that their jobs were going to be taken by the robots, right? And we've kind of covered that already in the other vendor sessions. But in fact, now 78% of workers actually recognise that technology will enable them to deliver better service. And if you think about what we've all been through in the last few months, and there's an analogy called same storm, different boats, and I really love this. So you could be a worker that perhaps is in a customer-facing role, maybe within a job centre or within a local council walk-in centre. Of course, these facilities were shut, and a lot of these workers had to be moved home workers, and they've never delivered that sort of citizen care over the telephone or even over video before. So there was a lot of nervousness, a lot of anxiety, and these workers also were going through the storm themselves. So Neva, our female avatar multitasking bot, enables them to be able to give the right information, compliant information at the right time, and have peace of mind that they're saying the right thing. And I think, again, having been what we've all been through, in order to give those employees that peace of mind is absolutely paramount importance. And then they are enabled to actually deliver the right service, underpinned by the automation. And there's a lot of focus at the moment around emotional intelligence within the contact centre. And it shows that the more empathic the employees can be in terms of delivering that care, the better service and the better experience is actually given to patient or whoever that might be. So let's look at one particular use case. At Nhs Lothian, we've been working with them now for a year, and they use their attended automation licenses in a similar way that Blueprism was actually explaining. So these are cloud-consumed licenses. So different units within the hospital are starting to share the licenses. So right now, they're going through a process to clear clinical backlog. So some patients have been to their GP, probably in November last year, and the GP has referred them to the hospital. That patient was told that their appointment was, let's say, the 5th of March, and of course that appointment never happened. So now these clinicians need to call these patients back and clear that backlog. And using a decision tree, an automated decision tree, the clinician is able to guide that patient. Now, it could be that the complaint has gone away, so they don't need to see anybody at all. It could be that the patient actually just needs to have a different prescription. So again, they don't need to come into the hospital. It could be that they do need to come into the hospital, but under what priority? So the clinician is able to triage them in a really safe and accurate way. And the impact to the patient is improved pathways, because it could be that they don't need to go to the hospital, so happy days. Or it could be that they are, they're classed as a priority, and therefore they come in and they see the consultant at the right time. In terms of accreditation, Nhs Lothian want to be really, really self-sufficient. So they've been through the whole of our Neva University online training, which is either desktop enabled or by using our training app known as Dojo. Equally so, other trusts and other organisations want to have a safe pair of hands around them, and over time they'll become self-sufficient, but we absolutely handhold them through the whole of that experience. HMRC, so we've got around about 20,000 Neva bots working with the advisors. I think we've all called the tax office at some point, and we've all experienced perhaps long wait times of over 30 minutes. We've been able to reduce it by over 50%. obviously the impact there for the citizen speaks for itself, but we've also been able to shave off the average handling time, and let's face it, none of us actually want to call the tax office. So that's a positive outcome for all experts. So let's look a bit further at some other use cases. So NHS 24, now these advisors recently weren't able to work at home because of their own compliance policies. So the advisors still had to reside within a contact centre, but with the spacing obviously at heart. The agents were actually still using paper timesheets, which they were handing over to their team leaders. The team leaders were then personally handing them over to the planning supervisor. And this analogy is quite common. And we've been able to automate them by integrating with their workforce optimization platform, which resides in the contact centre. Think NHS 111, so removing unnecessary A&E episodes. So in England, quite recently, no citizen can just drive down to their A&E department if they've stubbed their toe at home and expect to be seen. Obviously, this is a massive strain to our hospitals, not to mention the financial impact to the NHS. So now all citizens have to call NHS 111. The agent will triage the call. And indeed, if the citizen is deemed as you need to go into hospital, they'll be given a case reference, and then they will go down to the A&E department. And NIVA will populate the patient record at the patient's GP surgery, equally so also populate the hospital record. One of the other vendors today has mentioned CQC. So this actually shows the beauty of the fact that NIVA is proprietary. So if you've already got investment in Blueprism, NIVA will actually play nicely and fully integrate with your existing investment. So the CQC has a huge backlog of registrations for practices, doctor surgeries, new dentist surgeries, that sort of thing. And so NIVA is helping the staff to actually clear that backlog of applications. Safeguarding, clearance and vetting. So let's say somebody's applied to become a teacher to start in the new school year. NIVA can actually speed up that process. And again, it's a huge backlog that's built up because of COVID-19. So we're helping to clear that so that the teaching staff essentially can start work. So again, it's helping to actually get the economy going. The Met, so we've got over 3,000 police departments globally using NIVA. But using it to identify demand creation, and this is a term that's used by the police service within the UK, certainly within England, to be able to deploy the right services. So using NIVA to guide the advisor on, is that a robbery, is it domestic violence, and using our voice of the customer analytics to ensure that, again, the advisor is deploying the right services. Public safety, policing and justice. So, saving time and effort by removing the need to type up calls after certain events and populating them across all the different systems. So fully integrating and acting as a glue to populate and ensure that the demand creation is efficient. If we look at the top 6 factors that are reshaping customer experience and citizen experience over the next 5 years, we'll actually see that RPA is cited as number 5 there, but we've got customer analytics, digital integration, artificial intelligence, workforce optimization. And then if we look actually at how those measures are actually underpinned by our broad portfolio. So just to give you an analogy, so let's say if you've got vulnerable customers that are calling into a contact center, maybe somebody is now unemployed for the first time. He's really anxious. He's calling into a contact center. He's speaking to the advisor. We can actually pick up real-time sentiment by the distress, by looking at the pitch and tone or looking at certain keywords that he's actually saying to the advisor, and then be able to route the call to the right advisor, regardless of where they are. So they could be based at home as well as in a contact center or, within a branch. And then we can actually offer real-time guidance. So this is where the different capabilities that NICE offer from the cloud or hosted privately in a data center, or it could still be on-premise because we understand that some customers still want to keep certain solutions on-prem, and be able to blend them for the maximum outcome to the customer. And that is it from us. Thank you very much. Any questions?
Thanks very much, Kat. I suppose the first question is, you mentioned a number of use cases that you have ongoing. Who's your biggest public sector client?
I would say that was HMRC. It's not one that I've worked on personally, but we've got over 20,000 agents up and using NIVA and have been for quite some time.
Okay. And there's a question here from our own Janice Whitcomb from our department who asks, how important is standardization? And typically, is there an awful lot of pre-work to be done before your solution can be applied?
Yeah, we go in and, of course, fully scope it out. So we look at existing processes, day in the life of the agent or the worker studies, for instance, and then look at what the art of the possible might be, look at different processes, perhaps put it in a free proof of concept or maybe in a live environment as a trial. So there's different ways that we can approach it by working with the customer, depending on the size of what they're trying to achieve, their timescales. Yeah, so it really depends, different instances.
Right. And I've asked the others, so what is your USP?
I think our USP, again, is the approach that we take to make it extremely bespoke as we can. Again, in terms of consuming licenses from the cloud, so a number of our hospitals are repurposing licenses. So it could be that you've got a demand, let's say, of 30 licenses for this month, but next month you can pass them over to a different department to consume.
Fantastic. Listen, thank you very much, Catherine and Simon. I'm going to hand over now to Louise McEntee from Deloitte.
Thanks a million, Philip. And thank you, I suppose, to everybody, to the teams from UiPath, from Blueprism and from NICE. I mean, there's a huge amount of inspiration there around, I suppose, what's the art of the possible from an automation perspective and what can be done and what is being done. And I suppose that was the key thing out of the session today we were hoping to achieve was, you know, an overview of what each of you has been managing to do. Really, really impressive projects, really, really impressive outcomes for citizens and for employees from across the public sector. And I suppose that's the main aim of this framework. And I suppose a big thank you as well to Philip and to John and to Dr. Lucy Fallon-Byrne for hosting the session today. I mean, the RPA framework is a really, really innovative way of engaging with each of these partners. And I suppose that's what's transformed how we've been able to bring automation to the public sector over the last number of months. It feels longer, just it feels like it's been big impact. But I suppose the key thing is, under the framework, a lot of organizations have now started to deliver their automations. And, you know, we thought maybe back in January and February when things were slowing down and COVID was starting to have an impact, that this might impact on our ability to deliver automations. But I suppose what we're seeing is actually accelerated, and a number of public sector organisations locally in Ireland, key central government, key local government, key health and other agencies are continuing their automation journey and probably accelerating towards that now. And I think the framework, I suppose from our perspective, is a really fantastic platform to be able to talk to each of you around what your challenges are. You know, how are you coping in the current COVID-19 situation? How can you relieve pressure on individual teams and individuals who are trying to you know, find ways through these challenges and continue on this path towards automation. And I suppose the framework is there to help you, and I suppose that's the key thing that we're want to highlight today. You know, you're automating for the reason of enhancing the citizen journey, for enhancing your employee experience, for all the reasons that are on the screen here behind, you know, around standardization of your processes, around compliance, around traceability, around efficiency, but ultimately to improve the experience for the citizen, to improve the outcomes for your employees, and to help, you know, get on top of the major challenges that you have in front of you, from backlogs, from keeping the services that we need to operate, to continue to operate. The framework is there, and I suppose I've said that a few times. It does allow you upfront to have a conversation with Philip, with John, and deeper with ourselves and Deloitte about what is the challenge you're trying to meet. And I suppose also then for us to bridge that conversation to each of the vendors as well, to say, well, what is the best way to do this? What's the most efficient way for you? What's the most effective way for you to do this? And through the framework, you can draw down that help and those services. You can also just come and have a conversation, though, about how you're going to tackle this challenge. Through the framework, you can do those services, but you can also get the licenses that you'll need. You'll also be able to access training that you need as well. And you will be able to also get support that you might need over the course of that time. So the framework is there. I think the main message is come, have a conversation with us, have a conversation with Philip, have a conversation with John. There are so many really interesting and exciting projects from all of the vendors. And I mean, you've only seen a snapshot, I'd say, of what's out there at the minute. I think they're all so keen to work with you and so keen to help you deal with the challenges that you're currently facing. So I know we're going to go into a Q&A session now. There's been lots of really interesting questions that have been coming up over the last hour or so. So Philip, do you have any question you want to start with? Or?
Yeah, I suppose one question that has come up earlier, and I held it off for this session because I know it happens regardless of vendor, and it's about resistance from people. So how do you overcome, or do you encounter resistance from people when you're trying to introduce RPA? So I don't know if any of our vendors or if you have a view on that.
I'll take the vendor start. We're not seeing resistance. You know, we're kind of seeing the opposite at the moment. But certainly around attended automation, it's a bit of an unknown still. There's still a lot of organisations that don't even know this exists. They understand that obviously back office automation is there and RPA is there, but certainly from an attended to enable the agent, and also, you know, our attended automation has inbuilt automation finder. So NIBA will naturally be looking to see other processes that can be automated. So as we explain all this, we're really not finding any resistance at all in the marketplace, which is great.
I think Philip, if I can jump in here, what we are trying to see is, I just take, say, the Irish Passport Office as an example. When we first had the discussions with them, I'm not going to lie that the staff were nervous. You know, well, now you have a scenario where the exact same staff are encouraging their bosses to re-sign the contract for 3 years without the robot. You know, we had 40 people at a session in the Mather Hospital yesterday, you know, coming up to us in a long line of, I have ideas, how can automation help me? You know, I think people have realized now it's here to work as a digital assistant. It's here to lift the burden off people in the public sector, and it's here to help give a better service to the Irish. Working at the Mather Hospital protection. And it's not just that, it's also people are gaining a new skill. They're becoming self-sufficient. They're learning new things on their job on a day-to-day basis. You know, they're seeing an investment in them as a person as much as anything else. So that's where I think it's happened now is, and what we're seeing is the ideas are coming from the bottom up. This is not being dictated from the top down. And by embracing it and working with the people that work in the organizations to get their ideas and see their ideas come into fruition and see the benefit of that happening and the knock-on benefit of the Irish public talking about it, you know, that gives it unbelievable job satisfaction. I think the fear is gone.
I think
Philip.
Yeah, thank you. I think to really more. I actually. Pardon me.
Sorry, you're a bit robotic there yourself, Phil.
Okay, mate.
Try again.
I think what we've seen, I think we have absolutely come across cultural hesitancy. I can give you an example. This is a direct finance representation.
Hello, could Patrick perhaps take that question instead, Phil, because your microphone is acting rather odd.
No worries. I think what Phil was going to say is, I think culturally there's been a massive shift. I think when we're engaging with clients, you know, we run a number of process workshops for free for a bit of a hearts and minds piece, but don't take away the fact that what we're fundamentally doing here, or how people perceive this, and as we all know, perception is reality, is that people are, certainly managers, or how they feel about this, is that managers are basically saying to staff, you're inefficient in certain areas, you can't work 24 hours a day, you make mistakes, this robot doesn't, and therefore it's going to do your bit of the job. And the reality actually is that, you know, those things are true in that they can't work 24 hours a day, but empathy, compassion, verbal reasoning, subjectivity are absolutely things that as human beings we're amazing at. So I think there is pushback initially, but I think once they understand that bit of their job that they hate doing, they can just stop, then fundamentally there's a shift in attitude. But, you know, I counter what Mark said, I actually think that the culture has to be driven from the top. So when we're engaging with boards, they have to, I think, invigorate the conversation internally to say, this is going to benefit you because, and then at that point you start engaging with the subject matter experts. But it's definitely been a shift, I think, in terms of how we engage with the market.
Fantastic. I think we have about 7 or 8 minutes left. There is a question here around cloud and security, and I suppose concerns around using RPA in the cloud. I don't know if Tim is there. Maybe Tim could speak on behalf of RPA generally, or if one of the vendors wants to take that question. Really, can you use the cloud safely?
Can you hear me, Ellie, now?
No, I'm afraid you're still robotic.
No. I think just to pitch in again. I think, given that we are born in the cloud as a software as a service, there are absolutely, case studies, certainly I think in the police force, where they are maybe reticent to look at cloud. But I think these days, if you look at Office 365, the way in which we interact with cloud-based applications, I think that's shifting. If you consider that Blueprism bought Autonomy as a native SaaS offering, they did that because actually what they found was that a number of their on-prem customers wanted a SaaS solution, and of course all the benefits that brings. So I think there's been a shift towards that, but certainly in the NHS in England, I would say every single customer that we talk to, there's not even an on-premise discussion anymore. They want SaaS for the number of benefits that Phil and I discussed in our presentation. That tends to be the direction of travel.
Yeah, I would absolutely agree with Patrick. There's less and less intrepidation about public cloud delivery, whether we're talking about automation or whether we're talking about contact center technology, wherever it might be. There's less and less, but it does still exist. Some organizations might want to put the licenses within their own data center or host it in a private, data center on our hosted cloud, or indeed they might want to have them on premise, but it's a very, very rare case. And if they do, they want to be able to migrate them at a time that's right to them. So it's about giving different options to the customer and having a clear migration path as and when the time is appropriate.
Yeah, and I think Catherine, as you mentioned there, it's specific to every single organization, right?
Yeah.
There are clear benefits by going into cloud, and there are for many organizations some different issues with doing that. So it is a very particular thing that you need to look into for each organization. How ready are you to step into the cloud and gain the benefits that come from that?
Yes, agreed.
And sorry, we have from our own procurement expert who built the procurement framework for us, Derek Melia. He just asked very simply, where are your data centers?
So we're hosted on Microsoft Azure, so they have a number of data centers. You choose the data center that you want that in. So I can send a map of all the data centers that you'd like, but clearly you have the one that's closest to your site. So obviously there are a number in the Republic of Ireland, in England, Wales, Scotland.
I think so. In reality, if you look at it, with the government policy over the last years of the Hsc having their own data center, it makes sense to build the infrastructure in the data center out in Rivers building. It makes sense to utilize the infrastructure that has been built by the OGCIO on government. So we believe it's best to understand the requirements of the existing customer, but also understand the culture and the strategy of what's being built here in Ireland. Utilizing the government data centers, utilizing what the Hsc have built, but also having the ability to use the likes of Azure. So the decision is the customer's decision. We're helped to advise them on what is the best fit for them. But I think culturally, you need to understand what's going on here in Ireland. You need to make sure what's happening here and how it aligns with European policy as well. We have Brexit coming down the road. A lot of the examples would be, say, what's happening in the UK. We're very much aligning ourselves to government policy here in Ireland and working very closely with the people in Ireland who are making those decisions and aligning us very closely to their decisions. But we're just here to educate and help them.
Thank you, Mark. And actually, if anyone does want to get in contact with us, we can issue them a copy of the cloud policy that recently issued from the Office of the Government Chief Information Officer. Louise, do you have anything that you'd like to add, or maybe a question you want to ask?
I suppose there is one question there coming out from, it's Marie Manning has come up to say, you know, is there an evaluation stage or is there a particular process you can go through to see if a process is suitable? I mean, I suppose from our experience, the best thing in the first case is come and have a conversation with Philip and John in the first instance. And then what we can help you do is work through, you know, what is it the area of business you're looking at. I think, and maybe all the vendors will speak to this, the first project is probably the most difficult, just getting your head around what's the art of the possible here in terms of automation, and very quickly starting to say, well, why would I do this and what would be the return? Why? And never step into any of these projects without some understanding of that. Certainly on the framework and the methods that all of us will be putting forward, that is the first step in any of this. Let's understand your process and let's understand the return. But I think the key thing is come and talk to us in the first instance because we can help you sort of fast track those discussions.
And I think, Louise, to take, I 100% agree, you've got to dip your toe in at some stage. And I suppose if I take the example of what the HSC did, they engaged directly with yourselves there, but also the hospitals. If I use the Mather Hospital itself, and I know other hospitals have done similar, they've been using our task, our tool, Automation Hub, where they've been able to record their own process and see is it suitable for automation. So it's generating the knowledge from the existing staff and making decisions themselves to see whether it's suitable, and then they're submitting it in to see do the business agree with them. So look, we want to educate people. We want people to make decisions themselves. They've got ideas, and those ideas to be put forward and decisions to be made on what are the best automations for their organization.
Yeah, and similarly, as well as the Automation University for the accreditations for those that want to be self-sufficient over time, we've also got Automation Studio. People can have a play around and a bit of a tinker in a non-live environment to the heart's content to be able to get that confidence. But yeah, like you say, Louise, it all starts with that initial conversation.
And I think, Louise, as well, just another example, like I was amazed. I got an email in we did a session with Galway County Council, and 2 days later, one of the team from Galway County Council goes, I downloaded free software, I've been through your academy, and I've built my first 2 robots using your community edition. Can you help me? You know, so we understand the people in the Irish public sector. They're highly skilled people who have great ideas. We're just here to provide them with the tools so these ideas can be put into fruition, and we're just to support them in whatever way we can.
I think that's a really positive message. I suppose that is the key point of the framework. It means you can engage, it means you can have a conversation, and it means you can understand where you're going to go before you actually put pen to paper on getting any project started. I know that's been a consistent message through all our webinars, Philip, over the last number of months. Come and talk to us in the first place, and we will help guide you to the right people for the right conversation.
Absolutely. And speaking of which, I want to thank John O'Donoghue, who's been operating today's webinar for us. And John's the first port of call for anyone. So if you want to know more about any of the vendors, if you want to know more about the framework, if you want to know more about RPA generally, get in touch with John. It's easy to remember, rpa@per.gov.ie, and we'll take it from there. I suppose on behalf of the Department of Public Expenditure and Reform, from Lucy Fallon-Bourne, from the Minister, from myself, we want to thank everyone for turning up today. It was a great turnout. I think at one stage we had over 300 people, which I think is a testament to the interest that is out there in RPA. I want to particularly thank all of our speakers today, and Louise and the guys over at Tim and Shane over in Deloitte for working with us so well. We'll have our first birthday, I think, in August, so the framework will be a year old then. So I'll let you say your thank yous as well, Louise, and I think we'll wrap up then.
Yeah, a big thank you, Philip. I know there are a lot of questions as well that have come through in the Q&A there, so we will take those offline, and what we'll do is try and come back to you each individually or issue something with the notes afterwards. But yeah, a huge thank you to our partners in each of the vendors, UiPath, Blueprism and NICE. Really interesting to hear in your own words what the power of automation is. So yeah, excited to see what comes next. Thank you so much, everybody.
Thank you, everyone. Bye-bye.
Bye-bye.